Why do you keep on treating that STI, sorry, sexually transmitted infections? At first, it was called sexually transmitted disease as STD, but at one point they saw that WHO saw that this name was kind of stigmatizing, sexually transmitted disease. So they had to change the name from sexually transmitted disease to sexually transmitted infection, so that So my question is, why do you keep on having recurring STIs? Why do you treat your STIs and you're always in the hospital back and forth? Come, let me tell you. If you are sexually active, if you are treating STIs, you have to treat your partner. Yes. Because when you treat yourself, you go back to that person and pick the infection. So you are back and forth. And secondly, some STIs are stubborn, especially syphilis. You have to treat and go back for retesting. After you retest, if it's positive, you still treat. If you see it's still positive, you still treat until your TPHA shows negative, right? That's why you have recurrent STI. Another point is that poor treatment, inappropriate treatment. They are giving you treatment for something else. Okay, they are giving you treatment for chlamydia. They are giving you treatment for gonorrhea, and your main problem is syphilis. They are giving you treatment for syphilis, gonorrhea. Meanwhile, your main problem is chlamydia. It's not going to work there. You're going to treat the infection over and over and over and over again. So make sure if you're sexually active, treat yourself and your sexual partner. Second, always go for retesting after treatment to make sure the infection has been cleared off. Third, make sure your health provider is giving you the appropriate treatment so that you don't get to go back and forth, because you don't want to have side effects. You don't want to have what do we call this, consequences of STIs. There are a whole lot of the PIDs, top fallopian tube, cecilia. Guys, that's not that